I believe in order for leadership to change for a successful EMR adoption, there are a number of things that need to adjust within the organization. The first is the commitment to the organization that EMR adoption is at least in your top 3 priorities for the organization. You want to create witness and followership for this effort. It's not a project. It's a way of being. It's a journey, a multi-year journey, and you need that commitment. And the commitment has to be not only internally with your constituencies, but certainly externally with your community boards, with your communities, and your patients and those that you serve each and every day. Another key element of a successful change for leadership is constant communication and visibility of leadership, communicating this effort as a key to advancing your mission as what you stand for and your purpose in serving your communities. Another competency that needs adjustment is around patience. Part of what leaders have to recognize is now I'm having to delegate more, I'm having to trust more, and rooted in trust are 3 elements: sincerity, competence, and reliability. And part of a leader, because much more of the capacity is extended to their direct reports, and trusting in that delegation effort in order to get many of the activities accomplished. And a final competence that's critically important is visibility in the leadership. And that means managing by walking around, being available, communicating, even when we don't know the answers, but being authentic, where my head, my heart, and my feet are aligned to this mission, to this work. And so that there is commitment from all of our associates, confident in management, confident in the direction, and they can speak to that with regards to this tremendous effort and what it will do to eventually help us serve our patients, our communities, our physicians, and all of those around us. In my experience doing EMR adoption at Trinity Health, one of our greatest learnings was the importance of culture. Culture must be aligned to your strategy and structure as part of an effective EMR adoption. And part of our learnings initially was we didn't spend enough time in that space. We were very quick to focus on the levers of technology, of processes, and we didn't spend time on our people and culture. We changed that. And so now part of our Get Ready process, 18 months out, begins with putting together a people plan. And to really ensure that we have the right leaders in place, that we're supporting them with the right training and preparation, that we're communicating their jobs and their roles, that we're explaining the decision matrix and how they'll be held accountable, and more importantly, how they'll be rewarded and recognized. I mean, the holy grail of human resources is for individuals to feel valued, that their voice is heard, and that they're at the table. And that has just been a significant ingredient as part of our success and our learning as at Trinity Health, over 75% of our organization is moving to electronic medical records. So we are still learning. We still are very much a learning organization, sharing best practices, and that's what it's all about as part of this journey, which is so exciting. So let me just share a story with you with regards to the success of one of our ministry organizations as it relates to EMR adoption. One of our ministry organizations in Oakland, Pontiac, had physicians that really were not supportive of our effort. We had a CEO at that ministry organization who was very committed, who persevered the skeptics and the sarcasms and the considerations of not doing this work. And so he went out and put together a special event just for the physicians. Even invited their wives or their significant others or family members to join this effort and to really connect the work around people and culture to the efforts of this technology advancement, really meeting them where they are and really talking about what was possible and really creating a new care experience by having this technology and this foundation in place to help make their job easier, to enjoy what they do so that they can live their passion, live out their destiny of giving great care. And at that meeting, I would say that over half of the physicians that were in attendance were not supportive. By the end of the evening and the next day, he had over 90% of those physicians engaged, committed to a 3-day retreat in the coming months to really participate, to engage with the hospital, and to pledge their commitment to doing everything that was possible to be successful. So when we talk about success of EMR adoption, let me just again echo and underscore the importance of the CEO and the leader at the top. The shadow that leader casts for the organization is powerful. The alignment of the organization to the strategy, the structure, and the culture with the people is critical. And this was just one example of how he created witness for this work, the followership, because people trusted in his leadership to not only do the smart thing, but to do the right thing to really advance our mission and to be able to serve our physicians in a way that was going to enable them to deliver great care experience.